I'm Rick Buck, and I've been a dentist for 17 years. A patient came in the other day with this massive swelling in his upper left cheek. Right off the bat, I'm almost certain he has an infection on one of his upper left molars. However, it soon becomes obvious from my testing and the x-ray that he has two teeth that are infected. The wisdom tooth is the first one that needs to come out, but all I do is stick my elevator back there between his teeth and rotate it. It quickly loosens up and comes out, and my assistant suctions the tooth out of the mouth. Now the next problem tooth is the first molar, which is now the tooth that is second from the back. The first thing I do with this tooth to get it out is I drill a slot on the back or distal part of the tooth. I do this so when I apply that same pressure to the tooth, there is room for it to move and wiggle free, and it's not butting up against the next tooth to it. So if I didn't drill this slot in the tooth, when I put pressure on the tooth, it would draw strength from the tooth behind it and wouldn't move much. Now with that slot, there's some wiggle room to get this tooth moving. So I do the same thing I did with the wisdom tooth. I put an elevator between this tooth and the one in front of it. I then rotate the elevator in either a clockwise or counterclockwise motion. As I start to put pressure on the tooth, you can see that the tooth barely moves. Each tooth has little ligaments that attach the root of the tooth to the jawbone. As you put pressure on the tooth, it slowly breaks those little ligaments, making the tooth looser and looser. It gets to the point where you can see the tooth ever so slightly popping up as I'm putting pressure on it. But just watch, it will start popping up more and more. I always wonder what my assistants are thinking when they see the tooth moving like this. They must be like, just rip it out of there. But the thing is, you can't really do that. If you start putting too much pressure too fast, the root tips are more likely to break and would make the extraction more difficult, especially in this one that's not going to be that difficult. It's not a huge problem, but it is annoying for both the dentist and the patient if the root tip breaks. In fact, sometimes you break the tooth on purpose so you can get the tooth out faster when you take it out in pieces. But yeah, I just love this. This is just great. And the tooth is lifting quite a bit, but still isn't ready to come out just yet. Now I bring out the forceps to put pressure back and forth on the tooth, which will help break ligaments oriented in another direction than when I was using the elevator in the other direction. In my head, all I'm doing is putting pressure on the tooth in one direction and counting to 10. That's right. After all the schooling and experience I've gained, I'm just here putting pressure on the tooth and counting to 10, and that's how far math gets you as far as dentistry goes. Okay, there's a little bit more, but I digress. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. After I really got this tooth moving, I alternate between the different instruments and just keep my eye on how much the tooth is moving. Now, some of you may be wondering, the answer is yes. The feeling of loosening and pulling out is really satisfying. In fact, I really kind of like doing it. Unfortunately, the patient doesn't really share that same excitement, but there definitely is kind of satisfying feeling as the tooth is coming out. Ultimately, it's the forceps that really get the tooth coming out, and you can see it is really giving way and coming out now. And here it comes. Okay, as I pull it out, I'm just going to pause. You can see the infected granulation tissue is still stuck to the tip of the tooth. That granulation tissue was causing the patient a lot of pain right there. But if you allow me, I'm going to analyze the tooth further. Here I am showing you that there is also infection between the roots of the tooth as well. So this tooth was pretty badly infected. Can you see how one of the roots of the tooth is kind of dark and black? This is because a long time ago, for one reason or another, the tooth died, meaning its blood supply died off. Once the blood supply is gone, it can't fight the bacteria that gets into the root canals. And that bacteria start to stain the tooth black where they start to colonize. Eventually, the infection moves to the surrounding bone, like I showed you at the tip and between the tooth. Antibiotics can't reach the inside of the tooth due to the lack of blood supply either. So antibiotics won't help fight the infection in the tooth. And so once you finish the antibiotics, the infection sheltered in the tooth just migrates out again and flourishes rapidly. Now that I'm back at that extraction site, you can see me cleaning out the infected granulation tissue that's left in the extraction site. If you play close attention, you can see the bloody little chunks that I'm lifting out. Now, I just rinse the socket out after I've removed all of these, and this will all heal up in stages over the next few weeks to months. But this is why you just don't put off fixing teeth. These things always get worse, and infections like this can happen. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.